to this very special edition of Unlocking the Future with one of India's best medical professionals that I know, someone who has spoken at multiple forums across the world, a very dear personal friend who I can bank on with my life. So that tells you a lot how much I depend on this man for both myself and my family. Welcome, Dr. Kaushik Lahiri, for speaking to me on this edition of Unlocking the Future. As this country sort of starts to open up for Dr. Lahiri, there's a lot of negative rhetoric that's going on. I don't want to even get into that. I want you to tell me, there are many questions. Question number one, if I have to come to you, what do I do? If I have to bring my mother to you, my daughter to you, which in normal circumstances I would have done, but suddenly there is fear everywhere that I can't go to a doctor, the doctor will not see me. So what is a normal Indian citizen supposed to do from, say, next week when things open up?
Thank you, Boria. First, thank you very much for inviting me to this wonderful platform that you are doing, and I must congratulate you for this positive attitude with which you are doing this. Thank you very much. And all these apprehensions actually are rooted in ignorance. We don't know what exactly we need to do. Like when you are reaching an airport first time in your life, not essentially during this COVID era, you are a little nervous what to do, what exactly is the check-in counter, how to give my luggage, etc. And with this, that is also a new normal for somebody who has never taken a journey. So that is a new normal for that person. And this is also a new era for all of us. Certainly, you are most welcome to see me with your parents, with your little child to my clinic. Definitely, why not? But you need to follow some new rules, some new protocols. And before coming to the clinic, you need to be absolutely aware about these things, and then you can confidently come very safely, safe for you, safe for your family, and safe for us. But before that, I must tell something that there is another opportunity for all of us that is there since last week of March, that is telemedicine. Before or coming to the clinic, you can explore that option. Like it is a boon for everybody, not only during this COVID era, even post-COVID era, when everything will be opened up. A person who may not need a visit to the doctor's clinic for the second or third time, and he is staying 500 miles away from the clinic, he can definitely take this telemedicine option. This very simple, and just like I'm speaking to you, that is also a virtual meeting, and that is also a virtual meeting. You just need to upload your prescription and show exactly where the problem is, and the doctor is there to help you. That is what. And if you cannot do that, suppose your internet is slow and some other conditions that you cannot really solve, then you are most welcome to the hospital, to the clinic, but you need to know what are the rules.
So can you tell me about the protocol? Because anyone who is listening to this will want to know from an expert that, okay, do I have to make a pre-appointment? Do I need Arogya Setu? Do I need to fill a form? What am I supposed to? Tell us.
The first and foremost is all appointments should be pre-registered. Like you need an appointment. Definitely you can walk in, but before that, just give me a call that Dr. Lahiri, I'm coming, so that I can tell my front desk that Mr. Boria Mojumdar is reaching at 11:15, and make sure during that time nobody is around, because we don't need that so many patients in the waiting room. So patient calls the clinic, that is first. See the guidelines for phone appointment. And all consultations are pre-booked. This is number 2. And when the patient reaches the doctor's clinic, they should go through a triage. Suppose you are reaching the hospital, any hospital or any clinic, there will be a triage. And there you need to fill up the form. You know the Arogya Setu. The similar kind of questions will be there in the form, like your name and where exactly you're coming from, your exact address. And there we expect that nobody should write something which is false, because that is dangerous for that person and for the entire society at large. And name of the accompanying person and address of that accompanying person, reason for visit, And temperature. Now, my staff will definitely scan you for temperature. We all understand, we all are literate that even a person who is afebrile, who is not having a running fever, may also be carrying COVID. We all know that. But for a large population, this is a wonderful thing. Just scan whether you are a running fever. And we need to write that in the form. And after that, has the patient visited a foreign country? And now we have added, have you visited Maharashtra? Or are you coming from Delhi? Are you coming from Chennai? This is also important. And do you know anybody in your household, like your brother or anybody who has visited you very recently from foreign country or from other state? And if the patient is suffering from cough and cold or body ache or shortness of breath, even if you're coming to me for some other reason, for skin problem, but my staffs will ask you, Mr. Majumdar, do you have any cough and cold? You may feel it a little peculiar. I am coming to Dr. Lahiri for other problem. Why should I divulge about my body ache and cough and cold and chill and shortness of breath? But this is again new normal. Is the accompanying person suffering from cough and cold? So during the period of lockdown, in the wake of current pandemic, if you have downloaded the Arogya Setu app, please show that to our staff. So these are the basic things you need to do. And after entering, you need to sign that document and please wear the mask. No mask, no consultation. So absolutely there is no chance of rudeness, but that is normal. If you don't wear the mask, you'll not get petrol in the petrol pump. So that is normal. And hand sanitizers, our staff will offer you sanitizers, and we'll ask you, have you washed your hands in last half an hour? If it is okay, then it's fine. Otherwise also we'll just give you a few drops of sanitizer. And while sitting, you have noticed that if there is a 3-person can sit, only 1 person will be allowed in that area, because there should be a distance. And suppose you're coming with your daughter, and your daughter should sit about 6 feet away from you, not close to the father. So that may be a little peculiar. We need to know these norms. Like otherwise, one of my staff will come and with folded hands.
But why should the daughter sit away? Because at home the daughter and the parent are anyways.
We know that. We all know that, because once you are together, another person whom we are not sure about their comorbid condition, they also will use your example that they are sitting together. So why we can't sit together? So
okay.
we need to follow certain guidelines, and patient will be requested to not to approach the reception desk very closely. Like our staffs are also at risk from various patients. So you need to maintain a distance. And after that, we can allow 4 patients in a clinic. Like we have a sitting arena, suppose of 20 patients.
Okay.
We cannot allow more than 4 to 5 patients at a time. So that is the rule, because otherwise this physical distancing will not be, they may not be able to follow that.
Okay.
And my consultation clinic, you have seen that door will be open so that you don't have to push it. So this is a little difficult, because sometimes the patient are not comfortable if the door is open. And if the patient is not comfortable, then after they enter, we tell the patient to close the door. But every time we can avoid touching the doorknob. So these are the few things, and again, we can tell the patient to carry the digital prescription of my last visit. So I don't need the paper prescription. Just show me the digital prescription, and there will be a gap in the window. My AC will be off. So these are the little things that if it is a centrally air conditioned atmosphere, the air conditioner is better off. If it is a window AC, you can switch on the AC at 27-degree temperature and keep the door or the window little open, so that there is air can be circulated through it. Also, other than the cash, everywhere we expect the transaction to credit card or online transaction, so that even our staffs do not handle the cash. And even after the collection of cash, it is sealed in an envelope. Nobody is touching that. So these are the few things you need to follow when you are entering a doctor's clinic or a hospital from now on.
Excellent. Now, tell me, Dr. Lahiri, as a continuation from this, I mean, when this problem started in Bengal, for example, and early April, we saw many medical professionals get infected. At least the newspapers were talking about multiple doctors and nurses and healthcare professionals getting infected, hospitals closing down, whether it's the Charnock Hospital, whether it's multiple hospitals, you know that. We have now seen that number has drastically reduced. At least in the last 10 days, even in the post-Amphan context, we have not seen medical professionals getting highlighted as getting infected. Is it because they now know what the norm is? Is it because they now know that, okay, I have to wear personal protective equipment, this is how I deal with the patient? So are you guys more confident of serving us and helping us? Or what is the deal? Is the medical profession finally ready to tackle COVID in a more scientific way?
Thank you very much for raising this question. Actually, in the first 3 weeks, about 100 doctors were infected only in Italy. And now think about India. By the middle of April, we had more than 250 medical personnel infected, and a couple of doctors succumbed to this illness. You know about this in my city, in our city. There are two causes for this. Actually, initially, we didn't know how to deal with this new monster, honestly, because this is a new disease and nobody knew about it before December last or first week of January. And so the personal protective equipment, this PPE, the dress which looks like an astronaut, and we were not accustomed to see a doctor in an astronaut suit. We are not. So initially, this PPE were not there in every areas. We didn't have enough supply of PPE in all the government hospitals. We never had. So that's why even the medical colleges, government medical colleges, we have seen in the newspaper very disturbing news of 45 students infected in one day. So that is unfortunate. That situation, fortunately, we have overcome, because now from my state, one of the highest number of PPE is being produced every day, and we are very happy for that. And India is producing one of the largest number of PPE, and now we are exporting.
Can you please, as a senior medical professional renowned worldwide, confirm to me, as a patient, as a professional, as an informed observer, everyone listening, that we in Bengal or we in India now finally have enough PPEs in the pipeline or being produced, so that problem has been overcome?
Actually, I also represent one of the largest doctors society, that is West Bengal Doctors Forum, and we personally requested the Chief Minister in the middle of April. That time the situation was not good. Most of our doctors were not protected. So now, after our repeated persuasion, we are happy to say the situation is completely reversed. And in most of the area, even in government scenario, in also private scenario, it has changed, because our state is producing one of the largest number of PPE every day.
Music to my ears, Dr. Lahiri. Music to my ears.
So it is because now we are happy that even in the rural area, the doctors are offering single doctors. We are very, very apprehensive, because we didn't have any road map to walk on. This is a new normal. We didn't know when a doctor in suppose a district headquarters opens up his clinic, and when the hundreds of patients are around, how to maintain all this rules and regulation that may be very nice to read, but very difficult to follow. But now the doctors, the clinic staffs, all are with proper protection. And the basic things we expect from the patient are also being done by the patients. And as a country, India, we are producing one of the largest number of PPE. We are exporting that to the other countries. And Bengal is leading in that front. So that is also a very important message that should go from your program.
Excellent. And okay, as a follow-up to that, we are now opening up. So far, what has been done in this country is the center has stated what we need to do. The center told us lockdown, and we were in lockdown. Now it is pretty apparent. Even if you and I travel around Kolkata, we are seeing serious number of cars, shops open, offices open. Are you going to tell me, or do you agree with me when I say now the fight is becoming from the center to the community, from the community to the individual? So I am responsible for my well-being, and the fight now has to be led by me. Is that a correct way to state things?
Absolutely. And again, thank you very much for raising this topic, because from tomorrow onwards, we are entering the so-called lockdown 5.0. But actually, this lockdown is we need to exercise that from our end. The government has, for last 3 months, we have enough information to fight with this monster. The main weapon is information. You need to be informed about it, how to avoid this, and we know everything about it. I'm not repeating this. Now we are well informed. Now, based on that information, to protect yourself, to protect your family, and to protect the community and the country, it is up to you. The onus is on us. The famous dialogue, the onus is on us from now on, that we behave in a much more informed and better way, so that this menace is not spreaded. So because no government, nobody can continue with this lockdown forever, for our lifetime. So we need to open up. Definitely, the schools will open, all the offices will open, all our works will have to go out, the sports, everything will open, and we need to know how to keep ourselves safe in that new situation. So now the onus is completely on us.
Okay, let me ask you a follow-up to this, Dr. Laidi. I mean, we have constantly been told that elderly are obviously the most susceptible. On the other hand, for about 3 months, say my mother has not been allowed to go for a walk. Now, when things open up, do I permit my mother, or as a responsible son, take what call? If she wants to go for a walk, is she okay to go for a walk? Should I take her to an open space, say around the Maidan, where there is obvious social distancing, where she can walk around without being surrounded by people? The elderly, and obviously the child. The child is getting cooped up at home for 3 months, and it is not me. I'm asking this question as a father. I'm asking this question as a son. What about everyone? I mean, whoever is a father or a son, can they take such people out?
Yeah, my mother asked also the same question. So I'm sure my mother will also enjoy this. And this is a question to everyone. Yes, certainly. And if we perfectly follow this protocol, like wearing the mask and maintaining the physical distancing, there is absolutely no reason after another, say, a couple of months, I'll be very, very cautious about this, because for the next 2 to 3 weeks, when I was discussing with you, I told that we need to be a little cautious about it. And probably at the end of July or August, the situation will, in every country, it's happening. The peak, and then it's coming down. And probably we are coming to the peak. Probably we are at peak. And in all probability, it will now come down. Or it may rise a little and then it will come down. And after that, the people who are more than 60 or with some comorbidities like hypertension or blood sugar or other problems, or our kids, they are definitely, once the schools open up, when the government is more confident, definitely with following all the guidelines, we will tell our parents to enjoy life outside.
Okay. Now, say for example, me and my team, say people who are recording this and my colleagues who put together this program. Now, each of us have to come to office. Each of us have to come out to work. Say Vijay, who's coming out and serving the society. My colleague who's helped me put together this show. Jignesh in Maharashtra, or Pranjit who's helping to record. Say this team. Now, if they are coming out to work, and they will, if they wear a mask, if they wear a head shield, if they wear a pair of gloves, and obviously they sanitize, say every half an hour, 45 minutes, 1 hour, whatever it is, wash their hands 5-6 times a day. To what extent are they protected? Can they feel confident?
They should. Actually, the 3 mantra that we always tell is the physical distancing and hand hygiene and mask. So these three are the three weapons to fight against this. For everybody, for doctors, for sweepers, for all of us, all professionals, these are the things. For us doctors, this personal protective equipment is needed because we come very close to the patients. For others who are not coming that much closer, that mask, that hand hygiene, not even the gloves always, because putting on a gloves for 8 hours is not correct. But if you can change a gloves within a couple of hours, fine. Otherwise, every 2 hours, you wash your hand with soap and water or sanitizer and cover it with a mask and just maintain a distance. So that should perfectly work.
Okay. My last few questions, Dr. Laidi. One, as we had heard this about Bengal, and this is a Bengal-specific question. I now ask this question to a senior member of the Doctors Forum. All of you guys were asking for increase in tests. All of you guys were asking for more structured approach to this. Are you happy with what the state is doing now? We are now doing 10,000 tests a day, which is, according to me, significant for a state like ours. Obviously, the number will probably go up more. Are you happy with the Bengal response at this point?
See, from a doctor's perspective, happiness comes based on evidence, right? 4 weeks back, we were not happy. We are apprehensive. And as a body of advocacy, we repeatedly, it's not a question of criticism. Very positively, we advise the doctor, we advise the society, we advise the administration to do this. Because the purpose of lockdown is defeated if we don't do proper tests, because otherwise we'll not be able to know where exactly we stand. And now India, the national average is about 2,000, 2,300 per million. And we have the Bengal were almost at the bottom. But now we are doing 10,000 tests per day. And within a few days, it will be 12,000, then 15,000. It's not exactly enough, but per day, 10,000, 15,000 tests is also not a very small thing. And as a whole, India is testing 120,000 of its citizens per day. So that is also huge. And globally, we are almost touching 37 lakh. Can you imagine 3.7 million people already been tested in India? That is equivalent to the total number of tests in Germany, in Italy, and France. Their population is small, but we have already reached that level to as far as the testing is concerned. But per million testing, Bengal, it is almost reaching the national average. It is about 1,800, 1,900. It will cross 2,000. And we are not exactly very happy, but it's a very positive trend and we are on the right path. Correct.
Last 2 questions and very significant questions. One, as a medical professional who follows world research, every single day this sort of reading and seeing this vaccine development has become an addiction for us. I mean, it is almost a race going on in every part of the world. Who wins the race? Are you hopeful of some form of medical therapy coming in the next 3, 4, 5, 6 months? And are you hopeful, even if it is a partially efficacious vaccine coming in the next, say, 6 to 9 months? We are already in June. That is why I'm saying 6 to 9, because we were told 12 to 18 months is what people were telling us. So are you saying, I want to know from you, what is your objective expectancy as far as therapy and as far as vaccine?
As far as our information goes, about 150 labs all over the globe, they are trying for the vaccine. There's a race going on. But any vaccine, actually, I'm not going into the details, the recombinant vaccine, the attenuated vaccine, there is not exactly the virus is being injected, some part of virus is injected, or another virus on that shell, another RNA or DNA is given, and that is injected. Various kinds of vaccines are there, but to prepare the vaccine, it takes, I'm sorry to say, it takes 10 to 12 years. And we are trying to make it within 1 year or 18 months. So as a doctor, I'm not that hopeful that within 2020, a vaccine will hit our shore. I don't think it'll come to our clinics very soon. But yes, some form of remedy, some medicine, definitely, and all over the globe there are many works are going on other than remdesivir, then hydroxychloroquine sulfate, and many other medicines. Even from Bangladesh, there was a claim, and definitely WHO is looking into it because they claim some success. Various other things are going on, and by the end of this year, even before that, some medicine we should expect, not exactly the vaccine.
So, for example, we were told Glenmark, Hetero, Cipla, all these companies are now trying out various antiviral drugs. And we were listening to Professor Vijay Raghavan, our principal scientific advisor, and he was extremely hopeful of some form of therapy, saying India is doing well. And if you read American literature, if you read European literature, excuse me, there is talk that by the end of 2020 or maybe early 21, there will be some form of vaccination. I mean, yes, there is talk of you guys getting it first, which is logical, healthcare workers, frontline workers, but some form. I mean, even today morning I was reading Anthony Fauci saying, I still hold on that by November, December. Pfizer is already on record saying 1 billion doses. AstraZeneca saying the same. Does sort of these things give you hope that, okay, the medical profession, maybe not 2020, but at least by the first half of 2021, we will have some form of protection?
Definitely yes, because this is not the first pandemic we are facing. Maybe the first pandemic in the era of social media. So that's why it's like a game. Every moment we are getting, and it's getting on our nerves, we are getting nervous. But remember, human civilization has beaten all the pandemics before. We have defeated each and every pandemic. Even the smallpox has been eradicated. And we don't think about cholera. We don't think about tuberculosis anymore. So this is another disease we'll have to beat. We'll have to defeat. And another positive thing is, that is also really interesting. Even if there is no vaccination, even if there is no medicine, all viruses have a life. You remember the SARS disappeared suddenly after 6 months. There's no SARS in the world. So who knows, the COVID will disappear. And this is not as just a normal, as a doctor, but as a human being. We are hoping that definitely it will disappear, and all the works are going on to defeat it, and definitely it will be defeated.
Fantastic words, Dr. Lahiri. My final one, India, as you and I speak today, our recovery rate has touched near 50%. And, mathematical modeling, epidemiological modeling, now telling me from what I read as an informed observer, that perhaps we are starting to flatten the curve, that famous line, or the rate of infection is going in our favor. Maybe a couple more months to fight. Are you hopeful of that? When I ask you the Indian response, are you, when several people are saying, oh, you know what, the number is going up, but we are still opening up. This is scary. When we had 100 cases or 200 cases, we locked the country down. Today we have 7,500, 8,000 cases, we are opening the country up. What's wrong with us? We will all die. Is that a right sentiment, or it's a wrong, uninformed kind of panic that we are all getting into? You agree with the opening up? Your final comments.
Absolutely. Actually, we cannot stay back in home for rest of our life. Definitely, it's an enemy. It's a horrendous enemy, but we will have to fight, and we have, our preparedness was fantastic. This is the largest ever lockdown in the history of human civilization. 1.3 billion or 1.34 billion exercised the lockdown. That's the first time in peace time. So this has some effect. And mind it, there are various kind of virus strains. The same virus strain which attacked the US or Italy or Iran has not attacked us. So the mortality and it's much less here.
Can I stop you there? I mean, Dr. Balram Bhargav of the ICMR said these words, that every time he's been interviewed, he said, my concern is mortality. As long as we are able to control mortality, we will win this game. Because anyway, the mild patients or whoever it is will recover. Our whole issue now is as long as we are able to control mortality and keep it low, we will win this COVID fight. Is that right?
Absolutely. Just today, we have crossed the total number of deaths from China. Remember, China has a total number of cases of 84,000, and we have a total number of cases 1,84,000. And still, our total mortality is that of China. So that means that it is a hopeful condition. China, with a much lesser population affected, their mortality was much higher, actually double that of us. So this has happened all over the globe. Like, our mortality is one of the lowest in the globe. We don't know why. Maybe after this pandemic is evaporated, then we'll be able to research and we'll be able to know why. But at this moment, India's mortality rate is one of the lowest in the world.
Fantastic. I don't think I need to ask you anymore after that, because you've given me loads of hope. Loads of hope, as always, Dr. Laide. You are a born optimist and a fantastic doctor. Most importantly, you give all of us hope. You give all of us a lot of confidence. Stay well, because we need you. We need you to lead this fight in every possible way. And sooner than later, I will practice telemedicine, but I will also come and see you, because seeing you is always a great thing to do. Take care, and thank you very much.
Yeah, sure. Thank you. Thank you very much. Thank you.